how to drive a car. I didn't consider it your responsibility or your responsibility to pay for my kid to drive a car.
Well, whether you my dad, who's back there, still hasn't taught me how to drive a stick. So I'm not going to go to. Thank God. But that being said, we didn't at the state level. We did not cut. That was a school board decision, and your school board made that. So.
Bert Gammon?
Yes.
All right. You got a long one, so I'm working with you. We're going to do them one at a time. Bert asked me, do you support DROP? What specific changes to the program are you for? I'm sure you're going to want to talk to me later, but I do not support DROP. Although I don't see it going away, I would vote to repeal DROP, at least for those employees that have not entered DROP yet or are not within a couple of years of entering DROP. It's not a private sector initiative that could ever last. I'm not a supporter of DROP, honestly. Do you support, and this was a little tough to read because I know you have to write it on your knee. Do you support the, it's called HART Bill?
HART Bill.
Disability presumptions for LEOs and firefighters. Isn't that mean that if you have a heart attack, even off the job, it's immediately assumed it's because of the job?
No, duty related.
What?
Duty related.
It's assumed duty related? I do not. Do you support FRS continuing to provide a defined benefit plan? One that's paid into by the employee? Yes. If FRS returns to, this is a good question by the way, Bert, this last one was good. If FRS returns to 100% funding or overfunding again, should FRS cover employees still have to contribute to a % of the pay? Yes. Yes, I think that everyone should have skin in the game when it comes to their pension. I think that if we had always had a 2 or 3% contribution, we wouldn't be having this debate. And I think that we might be able to actually return to 100% funded one day if we stop some of the presumptions that we have in the law. Bert, you need to know, and I hope that you'll communicate with me as we go through this session. You're not talking to two guys that want to rape and pillage our retirees. Two guys that want to make some common sense changes, and there are those that want to rape and pillage. So let's just continue to work through that issue. Okay?
Yeah, just for the record though, from 1989 to 98, the FRS ran was overfunded significantly, sometimes at an average at 111% and sometimes at 118%. At some of those years, the legislature expanded risk classes and expanded retirement payments. So, and the other thing I would ask you all to look into, or I'll be more than happy to speak to you about, is it needs to be a true comparison of apples to oranges. Deputy sheriffs historically have been paid less during their careers of service, throughout their entire careers of service, because their employers paid into their FRS trust, into their funds for their retirements, where city police officers, municipal police officers have been paid several $1,000s more a year because they had to contribute a certain percentage to their retirement. Everybody knows those numbers. So I would just ask, as you guys go forward down this road, the FRS is not as simple as one law is applicable to everybody. There are cities down in South Florida, officers are paying over 14% of their retirement plans.
Yeah, Fort Lauderdale. You say Fort Lauderdale?
Yeah, Florida, officers are paying over 14% of their retirement plans.
Yeah, Fort Lauderdale. You say Fort Lauderdale?
Yeah, Boca Raton. So, I know for us, particularly here in Florida, we've taken over the last 2 years, 21% increase in our health insurance premiums. So, I just am trying to counter a lot of perception that we're not given. It's all paid. And also that the percentages need to be real and compared. You can't take a Brevard law enforcement officer and compare it to somebody who lives in West Palm Beach or Boca Raton. It's nowhere in this. Or
an FRS versus a municipal plan. That actually, the first when everything first started, it was all about really some of the mistakes the municipals had made, and that leaned itself into FRS reform.
Well, and I agree with some of the legislators who are saying these cities made these plans, they made these decisions.
Look, I don't believe in the federal bailout, and I don't believe in the county bailout
and
either.
Many of those cities promised retirement benefits that they knew they couldn't afford,
right,
to cut back on pay. Or if you look at Jacksonville diverted retirement money they were supposed to put in their retirement plan to other programs that they decided to fund, and now they're short. I mean,
there's certain things that we can fix, though. We require any surplus to go to a new benefit. That was a Jeb Bush plan. It's a terrible idea. I mean, that can't go to a surplus fund or a lockbox. You sound very reasonable.
And-
Look,
and-
just stay engaged with me for the next 2
One more thing
months.
I'll throw out.
All right,
If
so-
everybody's making drop the double, the state still has to pay the benefit.
Right.
Drop is only.
There's a guaranteed amount though, and that's
Yeah.
no one is making 6.5% on
6.5,
guaranteed money
yeah.
right now.
Don't have a problem with that. What I'm saying to you is, the only thing they're doing is saying, I don't want to retire right now, I'll go in a year or two, or I'll go in 3 years, whatever. That retirement benefit still has to be paid.
I would rather you continue to earn your benefit than go into the drop program.
Well, and I'll talk to you guys, I would love to talk to both of you about the double dipping problem.
Yeah.
Because that's not something we created, that's something that is not getting abused by us.
And it's the abuse that we're trying to fix. That whole, we talked about the trade-off of overtime. Thank you. Let's just continue the conversation. You mind if I move on and we'll get together personally? I just don't want, we're going to run out of time, but I will get with you, I promise.
We
Is
will
that all right?
answer, we'll stay after it.
I'll stay after you guys.
No FRS
I'll come
questions.
to you.
Okay, HB 415 would institute an all-out ban on abortion in Florida, with no exceptions for survivors of rape, sexual assault, incest, or fetal anomaly. It does not include any judicial bypass procedures for minors who may be harmed or forced to notify their parents, or if their need for an abortion procedure. Then it asks the question, how do you feel on this? Well, this is a Minister Van Zandt bill. Representative Van Zandt sponsored this bill, and quite frankly, he sponsored it last year. I think he's 415, so he did sponsor it again this year. I spoke with him on it last year, where I was a co-sponsor, and where he gave me his word that if it moved in along the process, which I think we both knew was not and will not again this year, that the rape clause and a few other clauses would be removed. Primarily because it has some serious constitutional issues. So will I co-sponsor it? Will I co-sponsor it again this year? I can't tell you, but I will tell you right now. I would not vote for a bill on the floor that would have, as I would have told you, as I told him there, I cannot vote for one that would have the rape clause or anything like it in there. But he gave me his word if it made the floor that type of stuff would make. But even if it did, it's got constitutional issues, so it would never even make the floor. So this is, the 415, like the one before, is nothing more than a statement bill.
C. Stewart, got a kind of a long one. Work with me on this one. Citizens insurance is her question. She says, must be curbed in the increase of premiums every year they pass on to the public. Right, so you want it capped each year. It's number one said need a cap on the increase. There is a cap on the increase. It's 10% currently.
Well, I spoke to John when I met him last year, and they had increased my mobile home insurance $140 in 1 year. So that's when I got in touch with Mr. Tobias. And I was recommended by Mr. Tobias' associate and the commission to reduce the value of my mobile home, which I just did, because they sent me another increase on the 2-bedroom mobile home. That it was increased again another $135 for this year. So I went from $1,300 to $1,500 last year, 07, and now they want $1,700 a year.
Right, you're not going to like what I have to say.
Which is the 10%,
so you can get worked up.
Which is the 10% in all fairness.
They did say, it's being increased, but it's ridiculous that you'd be paying almost $2,000 on a 2-bedroom total home.
Homeowners insurance is not a right. And unfortunately in Florida, 10, 15 years ago, the Florida legislature created a socialized program for insurance. And I believe in free market insurance, and I believe that we overregulate private insurers, and we certainly overregulate citizens. Let me be very clear. Each of you in the room know what your cost is for insurance, but you have no idea the price. Or you know the price of insurance, but you have no idea the cost. The next time we have a major storm, each of you that thinks you pay $1,500 a year in insurance, or $3,000 or $2,000, when you're assessed on every insurance product you own, you will then realize the actual price of insurance in Florida. Each of you hold a credit card in this state, and that credit card can only be accessed by one people, us, Tallahassee. And we will access that as soon as Citizens goes belly up, which it will do after the next major storm to hit this state. Because you cannot make campaign promises about keeping your insurance rates low and allow a free market system to flourish. The fact is, it should be pretty expensive to have insurance on a condo on the beach, and it also should be pretty expensive to have mobile home insurance in Florida. It's a hurricane-prone state. But we don't do that. We instead have socialized insurance in this state to the point where very smart companies are leaving the state because they realize they cannot operate in a state where the politicians set the rate of insurance. We must move to a system where these insurance companies can afford to pay the claims when they come, and that you are not left holding the credit card that you inevitably will have to pay. I know it's not what you wanted to hear, but I would vote to dissolve Citizens if that vote were to come forward.
We have about 10 or 15 minutes, so we want to go through these really, really quickly. Access to mental/behavioral health care in this county is extremely limited, particularly for lower-income individuals. In a recent community health survey, 30% of residents reported experiencing depression for a period of 2 years or more. That sounds bad, but actually, I think healthcare professionals diagnose depression on individuals. And this is likely to increase with layoffs at the Cape. How are legislators going to address this, especially with expected budget cuts? I'll tell you how we're going to address it. We're going to spend less money on it. The reality of the situation is, you saw it up there, we've got to cut $5 billion from the budget, and or the better part of $5 billion from the budget. That's coming from one place or another, and nothing. Education, healthcare, or public safety, there is no sacred cow out there. We're going to go through this and get rid of as many special interests as possible. Not that this is a special interest, but I cannot tell you one thing right now that is going to be fully funded, and to sit here and tell you that we are going to level out mental health or behavioral health care access to people that can't afford it, I'd be lying to you. I tell you this will get cut the exact same as pretty much everything else will.
That was my question.
Sure.
I just want to make a point that we're already 48 in the nation in mental health spending per capita.
So we have 2 more to go, right?
That's not really healthy attitude to have.
It's just a joke.
Gotcha.
Oh, I-
30%
you gotta-
of people in this community are self-reporting.
Well,
Mental
yeah,
health
you-
issues and suicide rates are going up, and you're going to lose half your workforce.
Well,
So-
you're
That's
right.
because
You're right
you're
there.
taking cigarettes away.
30% of people are self-reported as depression.
That
You
was-
know, and I thought you're a healthcare professional, aren't you? I know we've meant to. You can't let people diagnose themselves. My arm hurts. I think I have
They're not diagnosing
shingles.
themselves. They're
You said
reporting.
self-reported.
That's
Self-reported.
that's a study that's conducted by the Health Council of Eastern Florida, which the state legislature mandates. It's in the Constitution. So that's data that's collected by an agency that you don't fund. So if they're not doing their job right,
there's
don't
defund that one.
There's another place we need to cut to.
I'm having a really hard time reading this, so if you see this, if this sounds like you might want to help. What have you done with the list of unfunded mandates from Indian Harbor Beach? It's a great question, because what we've done as a legislature is, one of the things we hear all the time from our schools, from our counties, and our cities, is you're killing us with unfunded mandates. Right, Mayor? Unfunded mandates, unfunded mandates, unfunded mandates. An unfunded mandate, for those of you that aren't familiar with the term, are simply when we pass a law in Tallahassee and we direct the locals to do something and we don't fund it. Now, I will start by saying that counties and cities are an agency of the state, and they're to do the business of the state on a local level, so I don't actually believe in unfunded mandates, but I will tell you that there's several things that we pass on to our cities and counties that are probably not necessary. In fact, let me rephrase, that are definitely not necessary. Like small cities having to do a comprehensive plan every 2 years, even if they're built out. That's about a $45,000 endeavor, and they're built out. What are they going to do every year? Yep, same as 2 years ago. Thanks. 45 grand. So there's things that we can do, and there are things that we have made them do that cost them money. So we as legislature went back to all of our municipalities and counties and said, give us a list. Some of the things are like roads. That's not an unfunded mandate, but many of them have come up with really good things. We are absolutely 100%